Welcome to the Group Dentistry Now show, the voice of the DSO industry. Kim Larson and Bill Newman talk to industry leaders about their challenges, successes, and the future of group dentistry. Visit groupdentistrynow.com for more DSO analysis, news, and events. Looking for a job or have a job to fill? Visit joindso.com. We hope you enjoy today's show.
I'd like to welcome everyone to the Group Dentistry Now show. I am Bill Newman. Today on our show, we have Dr. Dan Davidian, and he is the founder and medical director of Anutra Medical. So first off, welcome to the Group Dentistry Now show, Dr. Dan.
Thank you. Thank you for having me.
So Dr. Davidian is the founder of Anutra Medical. Anutra Medical's products, they neutralize and deliver dental anesthesia, and we'll talk about that later on in the podcast. Dr. Davidian graduated from the University of North Carolina's School of Dentistry with his DDS degree. He has completed additional training in advanced life support skills at UNC and also received his sedation training with the American Dental Society of Anesthesiology. Dr. Davidian trained at Ohio State in advanced airway management. He also trained at the Medical College of Georgia and received his IV sedation certificate, as well as additional advanced life support training. Sounds like you have a lot of training here, so I won't go into all of it. But again, thanks, Dr. Davidian, for being on the Group Dentistry Now show today.
Thank you for having me.
So obviously, a historic time in the dental industry, to put it lightly. So we're going to talk a little bit about what the entire dental industry is going through right now with the COVID-19 crisis. And wondering, why don't we start off the show by asking you a simple question, maybe it's not so simple, but what do you see as some of the biggest challenges for providers and then also for the patients as we work through this, as we come out of the COVID crisis and we go from stay at home to opening up our practices?
You know, I do want to start by kind of saying, as medical providers and as dentists, I do feel like it is our obligation and our oath to our patients to be seeing our emergency patients. So, you know, as a whole, as a community, I feel like we need to, you know, our healthcare providers and our nurses are seeing patients and they're seeing emergencies and they are risking their health to see those patients. And I think many dentists are sitting on the sidelines and kind of waiting for the green light to go ahead back to work and aren't seeing emergencies or anything. And philosophically, you know, I do feel like you're shuffling these patients to the emergency room or urgent care facilities or even just the oral surgeon. You know, I feel like we should be at least trying to get back into the swing of the things as soon as we can, just out of obligation to our existing patients. But I would say that the biggest challenge we have with the stay at home is once we do re-engage in our practices, just getting that machine working again, getting the parts moving, getting the cohesion of the employees, getting them to want to come back. A lot of them are on unemployment and making just as much money as they would in our practices. We also have the difficulty of just getting the patients to feel comfortable leaving your houses, getting to our practices, getting in the front door, helping them feel safe, and getting them to value our dentistry. That we're going to be asking them to commit resources, that many of our pockets are stretched, and we're going to ask them to commit resources that might go elsewhere. So kind of convincing and messaging them on the value of what we do is going to be very, very important, especially over the next few weeks and months. And so this is kind of the time when we are going to have a little extra time, so it's going to be a good time to start focusing on those systems and products that will help make us more efficient. And when we're not as busy, they'll be a lot less disruptive to our patient flow. So a lot of the things that we've kind of avoided in the past, integrating into our practice because of any kind of practice disruptions, it might be a great opportunity to do that. So, you know, that's kind of where I feel like we're, you know, one of the biggest things we're going to be looking at as we get back into the system.
Yeah, I think you're right. There's a lot of, sounds like they're talk about moving parts. There's a lot of different things. It's the mindset of the patient, the mindset of the employees, making people feel comfortable on both sides, maybe not having enough money or being a little bit, from a patient perspective, being a little bit more cautious with how they spend their money, the caution regarding patient safety and employee safety. And you're right. I think what a lot of dentists and DSOs are doing right now is you have a lot of time to plan. So what are you going to do differently post-COVID? What are you going to need to do differently? So you've got time to plan now. So let's talk about a couple different things. I think the way the dental practices operate may look a little bit different or a lot different post-COVID. And so you've got typical dentists may certainly juggling different balls, different procedures, day in and day out, moving from operatory to operatory. Just as for instance, you have a patient that may need to be anesthetized for a procedure that takes 10 to 12 minutes. And then the dentist may go and do something else, see a couple other patients. Do you think that patient flow is going to change? I mean, do you think you're going to be able to move around at least short term like that?
Well, I definitely believe that the face of dentistry and how we treat patients is going to be dramatically different. And I think it will be a while before we're seeing the traditional hygiene schedules that we are used to. Although I'm a big proponent of getting back into continuing care and preventative care, I just saw a patient earlier this year who I had diagnosed a head and neck cancer on, and I found a lump on Monday. They were at the ENT on Thursday, and then ended up getting it removed, and it was cancerous the following Monday. So I think a lot of people undervalue what preventative care and what going to the dentist really is. But with that being said, we probably will start our hygiene protocols with, the more of the anesthetic-driven care, the periodontal patients and the periodontal therapies, which, in many of our practices, we have patients on 3 to 4 month recalls, and those patients may be on schedule or off schedule by a few months, but delaying them for a month or two may not be the end of the world. But many of these patients, if you put them off 6-8 months, are going to be in a situation where their periodontal health has diminished to the point where they might need periodontal scaling, which creates an added expense, and sometimes people don't follow through with that. And as we know, periodontal disease is linked to heart disease and diabetes and all of the comorbidities that we're trying to avoid with this COVID. So
right.
I do feel like we are, as a community, going to need to kind of embrace getting back into some of the preventative care and certainly the periodontal care. Setting that aside, I do believe we are the bouncing around and seeing a patient and numbing them and going to another patient and then coming back to see that patient is really going to be a migration away from that. We're going to really move towards a environment of limiting our points of contact with patients and multiple patients and patient-to-patient contact for the patient safety, the doctor's safety, and the staff safety. Not to mention, if we're bouncing around, the additional use of PPE is going to be tremendous. I see this kind of picture of what, the regulations are coming down. What kind of PPE are we going to be required? And a lot of people are suggesting we're going to be wearing hairnets and shields and 95 masks. And some people suggest we're going to be wearing booties and disposable gowns, which they do a lot in the EOR kind of situation. But I'm kind of looking at that situation where you've got significant PPE on, and you get all that on, you sit down, try to numb a patient up, then you got dirty gloves, so you got to take those off, put clean gloves on, take all that PPE off, go to another patient, put it all back on, re-glove, see that patient, then throw those gloves away, put new gloves on. And so I see this scenario of the more PPE that we add, bouncing around is not going to be the right answer from a financial perspective, just the waste of the PPE. And we are being asked to conserve PPE. And then just from efficiency point of view, it's really going to have a dramatic effect. I've been seeing a little bit of an altered schedule based on the fact that I use my anesthetic protocols change, which allows me to kind of sit with the patient and stay with the patient. And I did it mainly for the efficiency that it created and the financial considerations. But now more than ever, it's going to be not only that, but just limiting the point-to-point contact of the patients and limiting and conserving the PPE from a functional standpoint and a financial standpoint.
Yeah, absolutely. I didn't even really think about that. But yeah, as you move from one patient to the next, you may have to you spend an exorbitant amount of time changing the PPE that's already in short supply. It just doesn't make sense. Certainly from a patient perspective, there's going to be huge frustration, the additional time that would be involved. So that really leads into the next question. Patient perspective. It makes sense that everybody's going to be nervous, everybody being the patients, getting back into this unknown environment for a while anyway, where they're not comfortable. uncomfortable. So do you think that the traditional dental appointment is going to have to change? That's kind of what you're saying. So it'll be same-day treatment. I mean, do you think that's just going to be the norm regardless of what the appointment's for, or what are your thoughts there?
Well, absolutely. I mean, I think we're going to be in a situation for several reasons. So the fact that none of us have been open for a while means that we don't have a lot of patients scheduled out 2, 3, 4 weeks out in advance. And so when we open our doors, we're going to start seeing emergencies. Now, seeing those emergencies, it's going to make a lot more sense to see the emergency, have a protocol that will allow us to do some same-day treatment on that patient for several reasons. The economic benefit is, we need the production, we need the money coming through our practices. And then from a patient protective standpoint, if you're triaging them and trying to bring them back another day, number one, you're adding a whole nother layer of PPE that you have to reuse. You do today, and then you got to reuse some tomorrow. So you're not conserving your PPE. And so, from a patient safety standpoint, it's the right answer to kind of try to do some same-day treatment and more stay with your patient type treatment. So patient safety from conservation of PPE. And from an efficiency, as I've been practicing like that for the last 5 years, it's tremendously more efficient to stay with your patient than it is to start bouncing around. Most of the times we've been moving around from patient to patient based on the inadequacies of the anesthetics. And I talk a lot about that when I do lectures about why our systems are fairly antiquated, and now is a good time to really look at what are our protocols and systems, and how do we, evolve into kind of the new normal?
Yeah, that the new normal has been, I think that it was originally coined during the Great Recession, right? But we've brought it back for the COVID, and certainly hits much closer to home when it comes to dentistry and a new normal in dentistry. This new normal, what do you think the biggest single change would be for not just individual offices, but the multi-site or the DSOs from an employer standpoint? You have any thoughts on that?
Well, I do. I really feel like it is going to be that this time where we're going to have to sit back and really evaluate our practices as a whole and how we do things, and from an economic standpoint and from a staffing standpoint, and how, we have a lot of patients that are already apprehensive from coming to the dentist. They're going to be avoiding the dentist. You give them any reason to avoid the dentist, they're going to avoid them. So our emergencies are going to be a little bit bigger. The governors are saying stay at home. You've got, the natural fear of getting sick, stay at home, and then you have the natural fear of being at the dentist to stay at home. So a lot of these routine type procedures are going to get put off more and more, and they're going to become much more emergent and much more significant over time. I had a patient that came in last week that was, I had routine care back in January, diagnosed an MOD on tooth number 19. Patient didn't get in right away. Then COVID hit, hadn't gotten in. Came in last week, and the whole lingual cusp was fractured off. And so now that patient went from needing a filling to needing a foundation crown. Their doctor recommended they don't get their dentistry done because they didn't, they want to, say that we're not essential. And so now that patient's going to go another few months without the necessary treatment. And as we know, broken teeth can turn into fractured or lost teeth, or they can turn into root canals, foundations, and crowns. And we're going to start seeing this delayed treatment turn into more significant, more urgent type situations over time. And I think it is going to change the face of what we schedule and how we schedule as individuals and as group practices.
That makes a lot of sense. The longer people aren't going to the dentist, the more healthy people that have relatively healthy mouths are going to be in a situation where some of the things that maybe have been put off or weren't determined because they missed one of their 6-month checkups all of a sudden become something that would be considered emergent care and didn't necessarily have to be. So that's really interesting, and that could go on for quite a while, especially with the fear factor that some patients may have.
Yeah, it's an interesting thing, and I think you're going to start seeing a change over time. But you have a lot of pediatric dental offices that were encouraged not to do general anesthesia over this period of time, and it seemed like the right answer. But the unintended consequences of delaying these patients being seen for a month, now they're seeing a lot more children with emergent situations, and they were recommended not to do general anesthesia. And one of the issues now that they're facing is now they're seeing these emergency patients who have to be more held down and papoosed. And, as a dentist who treats high fear patients, that's what creates a lot of these high fear patients. And so I think as we as dentists band together as a whole, we really need to speak loudly about the unintended consequences of some of these regulations that on the surface seem kind of to make sense, And now you're seeing the consequences of not seeing patients for a month, and they really are they're already going to be significant. And I think it was the right answer for where we are now, but it's time to start letting the reins up, because I think people they're going to see a lot more of those kind of stories kind of panning out.
Yeah, absolutely. So let's talk about safety in the offices. Do you have some recommendations on how DSOs and dental practices can what steps would you recommend, and how are you going to implement them to keep an office safe for not just the patients, but also the employees in this post-COVID dentistry once you're able to get out and practice again?
Yeah, I mean, it's going to be a struggle. And I think as the individual states start putting their own guidelines and the individual boards start putting their own guidelines, we're going to have a much better picture of what that safety looks like. And I think now it is our obligation to keep our staff as safe as we can. And I think the best ways is doing as much of the protective equipment for ourselves and our patients. Some of it is going to be pomp and circumstance, just to help our patients feel more comfortable coming into the dental office, and they see that you are taking every step that you can to treat them as safely as possible. So I do think, we did talk about just the PPP thing earlier, as far as just the amount of it is going to change, and then how we practice and conserve it is going to change. I know we are probably going to have to, as a community, group practices and single practices, really look at some type of facility fee that's going to cover our PPP costs. A lot of surgery centers do facility fees. A lot of hospitals do facility fees. When I get my oil changed, they have a recycling fee. When I get a new appliance, they have a recycling fee. And so I think our office is definitely looking at doing some type of way to cover the protective equipment that we need, and for several reasons. And it's not just the expense of it, but I think, facility fees, encouraging facility fees, will take those dentists who might be unlikely to embrace all of the regulations and not use the appropriate PPP. If they're able to charge $10, $15, $20 for a facility fee, they'll feel much more comfortable, take the barriers to entry of them buying the protective equipment. And these N95 Max used to cost $1.50. Now they're $4 each, and you could go through in a surgical procedure if you have 2-3 staff in the office. And equipment, it may get costly, and so I think one of the things looking at is some kind of facility fee to kind of offset that as well.
Yep, I've heard that tossed around a little bit. It makes sense, and I think it also makes the patients aware that you're committed to their safety. They see that line item, so to speak. So there's, they understand what the cost is, and it needs to be recouped. So, yeah, it makes a ton of sense. Here's a big question then. Once we're through this, hopefully sooner rather than later, how do you think patients are going to value dentistry? Do you think they're going to value it more? Or are they going to value it less? Do you have any thoughts on that?
And it's interesting. I think in the short run, I've been very disappointed on how dentists have been valued through their own actions and through outside actions of a lot of the healthcare professionals, kind of implying a lot of dental offices should close and should not be doing dentistry. So I think that is disheartening. I think that we will start to see the value increase dramatically as we start to realize, and as we talked about earlier, the unintended consequences of leaving this preventative care for months at a time. You're going to have patients really realizing that when they come in with that broken tooth that could have been a filling 6 months ago and now it's a crown, I think the value is going to increase. And I think it is an interesting season right now where I think we're going to start seeing a migration, and we've fought against the stereotypes of dentists not being real doctors for a long, long time. And I think we need to fight those stereotypes and really practice dentistry, practice preventative dentistry. And I think we need to message it to patients and help them understand why we do all the things we do and why it's not just a elective type procedures, and why a lot of these preventative things are of value.
Agreed. And it seems like the industry was getting closer to acceptance from a standpoint of people valuing dentistry with the proven this oral systemic connection. So I think we're getting there. But of course, with some of these government mandates, and again, I think people will look back, right? Hindsight's 20/20, and say things could have been done differently. Who knows? maybe they were done exactly right. I don't know. But I do think that the industry needs to hammer home that oral systemic connection and look at who's dying from COVID-19. And then a lot of it is tied to diabetes and obesity. And you look at the oral systemic connection and how we can maybe eliminate some of these issues through healthy hygiene and good dental practices. Hopefully we can create some value around dentistry, given that.
Absolutely.
Let's talk a little bit. We don't really talk much about Anutra Medical and the products that you offer, but just as a whole, Anutra and then maybe some other products out there. Talk a little bit about what type of products are we going to see dentists using in order to help patients get through this? What products are going to be used to make dentistry a little bit more efficient going forward? And we talked a little bit about that same-day treatment, which was just going to be something that's going to be imperative post-COVID.
Yeah, I think we've kind of danced around the fact that we are going to be seeing same-day treatment in more emergencies. And so all of those kind of systems that we can implement that will allow us to do that more effectively are going to be hugely valuable. I've been preaching same-day treatment and stay with your patient for the last 5 years. And, I do a lot of CAD/CAM dentistry, and I do a lot of, and I've changed my anesthetic protocol. And being with Anutra Medical, being the founder of Anutra Medical, obviously all of that kind of stemmed from our anesthetic protocol. And I always preach that our systems of bouncing around between patients are developed around the inadequacies of traditional local anesthetics, because the body has to kind of bring those up to a physiologic pH before they work. So we have to wait 10 or 15 minutes. And now with things like buffered anesthetic, we can sit down with a patient, we can get them numb, we can keep our same PPP on, we can have a conversation with them. Even for a lower mandibular block, I'm able to get a patient numb within 2 to 3 minutes. And so many times if I'm doing quadrant dentistry and I'm doing 2 fillings, after 2 to 3 minutes, I'm going to tell the patient before we get started, I'm going to be polishing a little bit, because they're expecting me to wait 15 minutes. But by the time they realized I wasn't just polishing, I was removing the entire amalgam, is usually when I'm placing that matrix band, and it's usually about 15 or 20 minutes later. So I've been preaching stay with your patient for the efficiency of it, because uninterrupted work is 60% more efficient. And I've been preaching it for the fact that it's just more convenient for the doctors and the dentists. And now that we're kind of on the forefront of this COVID thing and really having to kind of look at point contact and how many points of exposure these patients are getting from a doctor moving around and how much PPE and conservation of PPE we're going to be using, it makes tremendous sense at this point to really evaluate all of our systems that are going to allow us to kind of stay with our patient. And, ironically, most doctors are reluctant to integrate technology or new technology into their practice because of the disruption that they assume is going to cause their practice and the time it's going to take to kind of implement it. And honestly, now's the time where we're going to have some more time on our hands, and implementing these kind of procedures are going to be much easier, because we kind of have to disrupt our natural flow of things and find our new normal. And so it's kind of that season where we've just got to reevaluate everything and look at products like Anutra that will help our practices not only in the short term get through these kind of systems and the emergencies and being able to do same-day therapies, but also long-term set ourselves up for the efficiencies that'll kind of make our practice thrive. After not having to bounce around as much as I used to, I'm using these products that allow us to stay with our patient. I've shortened my hours and I have a lot more free time. If I'm finishing an appointment in 15, 20 minutes, it really allows us to transition that room over, clean it the way we need to clean it, and set up and prepare for the next patient as well. So it's a good opportunity now to really focus on our personal lives and our professional lives and just find those things that will make us better as practitioners and as people as well.
Well, yeah, absolutely, Dr. Davidian. This has been great information, and I appreciate your time today. And I think you're 100% correct that things are going to look quite a bit different post-COVID. There are opportunities to be more efficient, opportunities to do things much more safely, and that helps out not just the patient, but the employees and the comfort level there as well. So now's the time to really take a look at different products and offerings that can really help you provide not just the safety, but the efficiencies going forward. So again, thanks for joining the Group Dentistry Now show, Dr. Davidian. And again, Dr. Davidian is the founder and medical director of Anutra Medical.
Thank you, Bill. I appreciate you having me.
The Group Dentistry Now show has listeners across North and South America, Europe, Asia, and Australia. If you like our show, subscribe today and please tell your colleagues about us.